Have you ever felt that nagging, burning pain in your stomach? That discomfort that just won't go away, especially between meals or at night? You might be dealing with a peptic ulcer. It's a common issue, but one that's often misunderstood. Today, we're going to demystify ulcers, diving deep into what causes them, how they're treated, and the simple lifestyle changes you can make to find relief and prevent them from coming back. Stick around, because understanding your body is the first step to feeling better. First things first, what exactly is an ulcer? Think of it as a sore that develops on the lining of your stomach, small intestine, or esophagus. This happens when the protective mucus layer in your digestive tract is worn away, allowing stomach acid to damage the tissue underneath. For years, people blamed stress and spicy foods, and while they can make symptoms worse, they aren't the main culprits. The two leading causes are actually an infection from a bacteria called Helicobacter, or H. pylori for short, and the long-term use of nonsteroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and aspirin. So, how do you know if you have an ulcer? The most common symptom is that burning stomach pain I mentioned. It can last from a few minutes to several hours, and often improves after you eat or take an antacid. Other signs include feeling full or bloated, frequent burping, heartburn, and nausea. In more severe cases, you might experience vomiting, dark or tarry stools, or unexplained weight loss. If you're experiencing any of these, especially the more serious ones, it's really important to see a doctor. Don't just ignore it or try to self-diagnose. Getting a proper diagnosis is key. Your doctor will likely start by talking about your medical history and symptoms. Then, to confirm it's an ulcer and find the cause, they have a few options. They might suggest a breath, stool, or blood test to check for HP. The most definitive test, however, is an upper endoscopy. It sounds a bit intimidating, but it's a straightforward procedure where a doctor uses a thin, flexible tube with a camera to look directly at your stomach lining. They can see the ulcer and even take a tiny tissue sample, a biopsy, to test for H. pylori or rule out other issues. This gives them a clear picture of what's going on. Once an ulcer is confirmed, treatment can begin. If H. pylori is the cause, the goal is to get rid of the bacteria. The standard approach is called triple therapy. This involves taking 2 different antibiotics to kill the bacteria, plus a proton pump inhibitor, or a PPI, to reduce stomach acid and help the ulcer heal. You'll typically take these medications for about 10 to 14 days. It's crucial to take the full course of antibiotics, even if you start feeling better, to make sure all the bacteria are gone. Sometimes, H. pylori can be resistant to the first round of antibiotics. In that case, your doctor might switch you to quadruple therapy. This usually includes 2 antibiotics, a PPI and bismuth subsalicylate, which is the active ingredient in some popular over-the-counter stomach remedies. It's a slightly more intense regimen, but it's very effective against stubborn H. pylori infections. After the treatment, your doctor will likely retest you to make sure the infection is completely cleared. Now, what if your ulcer isn't caused by H? If it's from long-term NSAID use, the first step is pretty simple. Stop taking those medications, if possible. Your doctor can help you find alternative pain relievers that are gentler on your stomach. Alongside that, they'll prescribe a PPI or another acid-reducing medication called an H2 blocker to lower your stomach acid levels. This gives the ulcer a chance to heal, which usually takes a few weeks to a couple of months. In very rare and severe cases, when an ulcer doesn't heal, keeps bleeding, or creates a hole in the stomach, well, that's a perforation surgery might be necessary. Surgical options have become much less common thanks to effective medications, but they are still a lifesaver in emergencies. Procedures might involve patching the ulcer, tying off a bleeding vessel, or even cutting nerves that control stomach acid production. Again, this is a last resort, but it's good to know the option is there for complicated situations. Medical treatment is the foundation of healing an ulcer, but your lifestyle plays a huge supporting role. Let's talk about diet. While no specific ulcer diet exists, some foods can irritate an ulcer and make symptoms worse. Common triggers include spicy foods, fatty or fried foods, citrus fruits, caffeine, and alcohol. It's all about listening to your body. Keep a food diary to identify what bothers you personally. On the flip side, foods rich in antioxidants and probiotics, like yogurt, berries, and leafy greens, can support a healthy gut and aid in recovery. Beyond diet, other habits matter too. If you smoke, quitting is one of the best things you can do. Smoking increases stomach acid, slows the healing of ulcers, and makes them more likely to come back. Managing stress is also important. While stress doesn't cause ulcers, it can definitely worsen the symptoms. Find healthy ways to cope, whether it's through exercise, meditation, hobbies, or talking with a friend or a therapist. Getting enough sleep is also crucial for your body's healing processes. Finally, a quick word on over-the-counter remedies. Antacids can provide quick, short-term relief from ulcer pain by neutralizing stomach acid. They're great for managing occasional symptoms, but they don't heal the underlying ulcer. Think of them as a temporary fix, not a cure. It's essential to follow the treatment plan prescribed by your doctor to ensure the ulcer heals completely and doesn't return. Don't rely solely on antacids without getting a proper diagnosis. So there you have a complete guide to understanding and treating ulcers, from the real causes like H. pylori and NSAIDs, to effective medical treatments and the powerful impact of lifestyle changes. The key takeaway is that with the right diagnosis and treatment, ulcers are highly curable. You don't have to live with that discomfort. Always work with your healthcare provider to find the best path forward for you. Thank you so much for watching. I hope this video cleared things up and gave you some valuable information. If you found this helpful, please give it a thumbs up and subscribe for more health content. Stay well, and see you in the next one.